Have you ever wondered why so many mothers of autistic children struggle with anxiety and depression? Many assume it's just the stress of raising a child with autism. But there's another, often overlooked reason: a genetic condition called the premutation of Fragile X syndrome. In this video, I want to talk about why mothers of children with autism or ADHD should consider getting a blood test for Fragile X syndrome, not just for their child's diagnosis, but for their own health and well-being. What is the Fragile X premutation? Fragile X syndrome is a genetic condition caused by an abnormal expansion in the FMR1 gene. People who have more than 200 CGG repeats in this gene have full Fragile X syndrome, which leads to intellectual disabilities and autism traits. However, there is another group: people who have a premutation of this gene. This means their CGG repeat number is between 55 and 200. They do not have full Fragile X syndrome, but their bodies are affected in a different way. Many mothers of autistic children unknowingly fall into this category. But how does the premutation affect mothers? Women with the Fragile X premutation often experience hormonal imbalances, early menopause and fertility issues, increased risk of anxiety and depression, higher sensitivity to stress, cognitive difficulties, including memory issues and brain fog. In some cases, Fragile X-associated tremor ataxia syndrome, FXTAS, a neurological condition that affects movement and balance. Because this is a genetic condition, these issues are not just caused by stress or exhaustion, they are biologically rooted. The FMR1 premutation affects brain chemistry, especially the balance of dopamine and serotonin, making women more vulnerable to mood disorders like anxiety and depression. Why is this important? Many mothers go years without realizing that their mental health struggles are linked to a genetic cause. They may be treated for depression or anxiety, but the root cause, the Fragile X premutation, is never addressed. Getting tested for Fragile X can help in several ways. 1. Understanding your mental health risks. If you know you have the premutation, you and your doctor can develop a better plan for managing anxiety, depression, and hormonal imbalances. 2. Family planning. Women with the premutation have a 50% chance of passing it on to their children, and future pregnancies may result in children with full Fragile X syndrome. 3. Medical support. Knowing you have the premutation allows you to take proactive steps in managing your health, including hormonal treatments, lifestyle adjustments, and mental health care tailored to your needs. How to get tested. The only way to know if you have the Fragile X premutation is through a simple blood test. Ask your doctor for a Fragile X DNA test, which will analyze your CGG repeat number in the FMR1 gene. If your CGG repeat number is between 55 and 200, you are in the premutation range, and if it's between 55 and 90, you are at high risk for anxiety and depression. Be aware. If you are a mother of a child with autism or ADHD and have been struggling with unexplained anxiety, depression, or hormonal issues, this could be the missing piece of the puzzle. Don't ignore the signs. Get tested and take control of your health. By raising awareness about the Fragile X premutation, we can help mothers get the support they need and improve their quality of life. Please share this video with other parents who might benefit from this information, and let's continue spreading awareness together. Subscribe for more videos on autism, Fragile X syndrome, and family health. See you in next video.